Um, so I guess we should start with the methodology. I mean, the introduction's basically like introducing what mental health is, introducing what AI is, etc. Um, like the main thing was it's a cross-sectional study, um, and then it was between mental health professionals, or not professionals, but the people who work in mental health in New Jersey or California. Um, because of it was me and it was me and someone else who participated in this group. So we had both New Jersey and California, because that's where we lived. Um, and what happened was we just sent them a bunch of surveys, and then they kind of like we got a lot of people to answer. I don't know if the actual form is attached here, but it's like we took one of the old we took another known questionnaire called the SHAPE questionnaire, SHIPAIP questionnaire, and then we kind of adapted it because they only talked about perception, so we added some ethical concern stuff as well, and then we modified a few questions. In terms of that, then we had to send the questionnaire over for approval, and then after that we could go on to the thing. With everything else, with sample size, I remember this being kind of an issue that our instructor like emphasized a lot, being that we have to get specifically to some level of sample size for our results to actually be meaningful. I think the number was like 190 something, and then we ended up getting like 200 people, so it didn't end up being an issue. With the statistical analysis, I actually don't really know the big details of the statistical analysis because we had statisticians do that. All I know is that it's the Kruskal-Wallis test, the Mann-Whitney test, and the using the chi-squared statistic. I don't exactly know what the details are though. So yeah. The results are actually pretty cool. So we got a lot more people who were like in the 30s to 40s. We didn't get a lot of young people, and we didn't get a lot of old people either. The gender split was like relatively even. In terms of like work, we got a lot more psychologists than anything else. And a lot more of them work for like hospitals or academic institutions than anywhere else. So with this, yeah, a lot of people said they got formal training on AI, like 63%. And then interaction with AI tools, like it goes down a little bit. A lot of people do not. And then there's a lot of people who are not that familiar. Like they say it's 90% is only somewhat familiar and only 9% is highly familiar. Here's just like a lot of the different tables and such. So everywhere here, it's the means around like 3 point something, which means that it trended towards agree or strongly agree more so. I don't know which ones are statistically significant. I don't know if they're marked onto here. All I know is that a lot of these answer like trended more towards like agree and strongly agree stuff. But generally people are aware of AI. And then people are aware of some of the advantages of AI. In terms of perceptions, people generally think that AI can be good for mental health, but in terms of ethical concerns, people are generally also agree with a lot of the ethical questions, such as like privacy and data security, such as ethical guidelines, such as bias, and like pretty much everyone agreed that informed consent must be given. So yeah. And then here's the paradox, right? So the barrier for AI adoption, this is the most interesting part, because Up here, we had 139 people, which is 63% of the sample, say that formal training on AI, they had formal training. Down here, they said that the biggest barrier was the lack of training, which showcases the sort of like difference between like theoretical training versus like practical application that's like kind of lacking here. Um, and like another one's ethical or legal uncertainty as well. The main three are lack of training, legal uncertainty, high cost, limited resources as well. The other two, lack of awareness and resistance to change, can also be some problems. And then to adopt, they basically said you need clear guidelines and regulations, you need research, and that's those are the two main ones. The other one being user-friendly AI tools. And then yeah, so this is interesting because up there it said 60% had formal training, and then down here, like the same percentage, which is around 60, says that they don't use any AI assisted systems in their work. And then this is just like pretty much the this is perception scores based on like their different, what's it called again? But like, yeah, so they have it in terms of age, gender, professional role, work setting. There's only a few that are significant. It's the years of clinical experience is highly significant, where you can see that if you have more experience, you answer lower on the scale generally, which means you generally disagree more with the propositions, which means I think in terms of the questionnaire, that's pretty much you are generally less receptive to AI versus like when you have like sort of, I think the golden time's around 5 to 10 years. You have more positive perceptions of AI. With formal AI training, of course, if you have formal AI training, you are more receptive to AI. Regards to familiarity with AI, if you're not familiar, you answer lower. If you're highly familiar, you answer higher. Same with perceptions. Again, it's the years of clinical experience. Again, if you have more experience, it's lower. If you have formal AI training, it's generally higher. And if you're not familiar, it's generally lower. I think it's the same thing with ethical concerns as well. Yeah, generally, more experience meaning less, like lower scores, as well as familiarity meaning also lower scores, with formal AI training giving higher scores generally. That's pretty much the end of the data. So I think the most interesting part was the perceived barrier of there not being enough training, even though a lot of people got formal AI training. I think that's the most interesting part that should be investigated further, definitely.